Ready? Is everybody ready? It's time to get going on this. Okay, thanks for coming. I know that I'm going to be talking about stuff that is going to be a little bit challenging for the community, and so I apologize in advance for any discomfort that this causes, but the health team really felt like that we needed to move on with our planning to how we would deal with COVID-19 symptoms in PDX Commons. So the good news is so far so good. So first of all, we want to thank everybody because we know that you're all working hard to keep the entire community safe. I think that people are trying to limit their trips. I think people are trying to keep careful social distance or physical distance or whatever you'd like to call it. And we really see your efforts. And I think everybody in this community is so appreciative of the efforts of everybody else. The other good news is that Oregon is looking good. Our curve is really flat. It's not expected at this point that Oregon will exceed the capacity of our healthcare system, which is excellent news, especially when you start looking at places like New York and New Orleans and Chicago and a lot of places that are really struggling. The kind of flip side of that good news is that we're not at our peak yet. Our peak is supposed to be in about 2 weeks. And so what that means is the behavior that we exhibit within the next week or two is going to determine how high that peak goes. So that means that we're probably at highest risk of contagion out there in the world in the next week or two. So I'm encouraging you all to just be extra careful about how many times you put yourself out into the public space, particularly grocery stores and other indoor excursions where you're going to have trouble maintaining that physical distance from everybody else, and wear your masks when you go out into those spaces. Flattening the curve as successfully as we've done it also means that we're going to extend it. So when you talk to the epidemiologists, which of course we have been, you'll see that the risk of COVID infection is going to last probably until a vaccine is approved next year. The only other way that we're going to slow down the infectiousness of this virus is when the majority, more than the majority of the population is immune. And that means most of us would then have to get COVID. So as we try to keep backing that off, we don't want to get COVID, we want to wait for the vaccine. What that means, of course, is that this is going to go on for a long while. And so the health team is really aware that we're not just talking about a few weeks, we're probably talking about months of protecting PDXC commoners. And as hard as we try, and as cooperative we are, and as safe as we want to be, statistically, it's likely that at least some of us will contract coronavirus over the next several months before the vaccine is available. And so that's what the health team has been losing sleep over. That's what we feel like we need to have a plan for. So it's really planning for what we hope will not happen. So the precaution levels have been helping us to try to keep it outside. And we're really hoping that that can be forever. It would be really nice if we could just be really careful and not ever bring it in the doors. But in order to protect us all, we have to be able to respond appropriately and quickly if one of us should start displaying symptoms of COVID-19 illness. So maybe it won't happen, probably isn't the greatest plan in the world, and we're encouraging you not to put your head in the sand about this. But the problem is that you'll see as I talk about this, you'll feel like your chest is constricted and you're probably starting to have shortness of breath and some of those COVID symptoms that we don't want to have. But it's probably just because your anxiety level is going to go up, because it's really hard to imagine ourselves in this particular situation. It's hard to imagine ourselves as the one who gets sick. But choosing not to think about it is not just not good for us, but it becomes dangerous for the entire community. So again, just as kind of a baseline rationale for why we're creating these guidelines, is that again, COVID-19 is not just like any other virus that has floated around PDX commons or our neighborhoods before we moved here. This one can be bad. While most of us, and even still the majority of us older adults, will end up doing fine in the end, this one can lead to very severe illness and death. Sometimes quickly within 48 hours, or it can leave us down and out and very sick for more than a week before we recover. This isn't like a 24-hour flu. This can be a really big deal. None of us has immunity, at least not that we know of, unless somebody has picked it up and asymptomatically and developed some antibodies. But as far as we know, everybody in this building is susceptible. And it is kind of unusually contagious because it's got that long latent phase, allowing for silent spread. And that makes it very hard to control. And that's partly why we're working really hard to maintain our physical distances within the community. Even though we're safer here than in the grocery store, unfortunately, there's no place that's completely safe. So the toll that it takes is that 8 out of 10 COVID-19 deaths reported in the United States have been in adults 65 years old and older. And the CDC breaks that down to look like this. Among adults who have a confirmed positive test here in the United States, about 31 to 59% of adults our age end up going to the hospital. About 11 to 31% of adults our age end up in intensive care. And up to 11% of adults our age can die from this. So this is something that requires a fairly draconian response because it's just that dangerous. In Oregon, and this I pulled off the Oregon Health Authority website yesterday, you can see that most of the cases are actually here between 40 and 60. But you'll see that the deaths are all here mostly, except for one under the age of 60. Pretty much all the deaths have been over the age of 60, and that's consistent with the rest of the country. But what you'll see is if you look at the number of cases and then how many were hospitalized, you'll see that, you know, when you're down here, you're working in the 10 to 12%, and then in here you get up to the 20 to 25%, and then you start jumping up to 37%, 40-some percent, and then almost 50% of confirmed cases end up going to the hospital for the very old population. So that's just by way of explaining why it is that we're working really, really hard to make sure that we don't have any unnecessary spread in our community. So what are these guidelines? I'm guessing that many of you have taken a look at these, but I'm going to step through them. These are the health team, like I say, have been working for so hard. Your team has worked so hard to take what we have learned from the CDC and you know, our own many years. We don't even want to count how many years of experience this health team has between us of our own knowledge of isolation precautions in the presence of contagious illness. We really believe that standardizing these guidelines and not just relying on people to sort of know what to do all by themselves is important to make sure that the whole community remains as safe as possible in the face of this active infection within our walls. The officers approved this just several hours ago, so it's really fresh, but we wanted to not wait to get it out there because we know that the curve is rising every single day, and every single day for a while, our own risk of having this happen inside our walls increases as well. So the very first thing on the guidelines is our request to all of you to make a personal plan about what you would do if you develop COVID-19 symptoms. We created a worksheet, and I'll go over that after I get done with the guidelines. So I'm not going to delve into that here, but what we really want you to do is to anticipate all of your needs, including your food, medications, pet needs, all of that that would be needed for 2 weeks of potential isolation. And we're also going to ask you how you plan to isolate yourself. And I'll go over that again in the second half of this. But that's what we really want you to do, is think about this. That's going to be an important step, is to not get sick in the middle of the night and then have no idea of what you're going to do or how you're going to cope. Then we're asking everybody, and we've asked this before in level 4, but to monitor your symptoms. And again, what we're looking for is new onset symptoms. So these are not things that you kind of live with, although most of us don't live with fever, but you're looking for that fever that's persistently at least 1 degree above your usual baseline, oftentimes accompanied by a cough, sometimes with the sore throat. The flu-like symptoms are usually pretty pronounced. The muscle aches, the lack of appetite, the just feeling lousy and not wanting to get out of bed. Shortness of breath usually develops later, but in some people it has come almost right off the bat. This virus likes to head straight for the lungs, and so it usually doesn't take a long time before it's heading south from your eyes, nose, mouth. It wants to live in the lungs and create problems there. That sudden loss of taste and smell that some British physicians have discovered may be a little bit of a clue that goes along with that. It's not diagnostic in and of itself. And for some people, there are more GI manifestations of this. That's not common, but it's occasional that something happens and you just get, your stomach feels bad. You get the diarrhea and the nausea. So what we're doing is we're trying to encourage residents to be really kind of not paranoid, not hypochondriacal, but sort of just being aware of what's going on with your body so that we can figure out that something's going on and isolate as soon as possible. And here we go. Isolation from the community is going to be the key. If symptoms appear, the resident and all cohabitants of that home have to self-isolate immediately. And our points of contact for the healthcare team will be Nina and Claudette, as we mentioned in level 4. They're the ones who are going to kind of know sort of how to help you proceed from there. Of course, you would want to be in contact with your primary care provider as well. We are not your primary care providers, but we can offer some guidance about how to function within the community and how the community can help you. The self-isolation means that you remain in your own home and you don't move at all through or use common spaces. That's just so important. It should not be in common spaces if you have any symptoms of COVID-19. And part of this is because we know that viral shedding is at its highest among people in the early stages of acute COVID-19. And that's when the risk of spreading the virus to everybody else in the community is at its highest. So if you have symptoms, go home, stay home. If you're not sure, text Nina or Claudette or give them a call and say, I don't know what's going on, but I've got this thing happening. Tell me what you think I should do. And they would be happy to help you. If you're acutely ill, obviously you would want to be in touch with your healthcare provider. If you're sharing a home, the ill person self-isolates into a bedroom alone. And that becomes the sick room. And hopefully it's got a bathroom. And if you're in your own space as a sick person, it helps to reduce the risk of passing the virus to any co-inhabitants of your home. So not only are you confined to your own sort of condominium, you're confined to your own room within the condominium if you're sharing a house with somebody who isn't sick. The ill person then should wear a mask every time they leave that sick room to move about the rest of the house, which is probably not going to be very often until they're recovering. And the caregiver should wear a mask whenever they're entering the sick room. The CDC is going to have guidelines for both the sick person and for the cohabitant. And those are different CDC links that are on your PDF that I sent out this afternoon. And so you can read those and see exactly what you need to do to try to protect yourself and others within your own home. So I think it's probably helpful to imagine yourself like Pigpen. If you've got symptoms of COVID, you just have to imagine yourself as just sort of having virus falling off of you everywhere you go and sort of leaving traces of that. Because again, that's when the virus sheds most acutely, is when you've got those symptoms, particularly in the first several days of illness. It's really important that the community understands that this is not like other things. It's not like helping someone after a surgery, or it's not like helping someone who's maybe got a cold or something, or just kind of feeling under the weather. Our ability to help is just going to be really limited. The Mitzvah Squad is certainly going to be ready to help support you, but they can only support you, as can the health team, in ways that do not involve stepping into your home. And that's going to be a big change for us, and it's going to be really difficult for those of us who are used to being helpers, is to understand that we can't be going in and out of your home. We just can't. It's too risky to pick up that virus and then spread it to other people in the community. So we're going to have to figure out how to exist without having that help. We don't have PPE. We don't have the stuff that we would need to adequately protect us from active viral shedding by an acutely ill person. And so that means anybody who comes in or out of your house when you're sick then becomes the vector to spread that virus around the community. And that even includes the healthcare team. And I know many of you are used to being able to call on us to come help you and assess you and help you figure out what to do next. We just will have to do all that digitally during a COVID-19 illness. We can't come inside your whole house and kind of help you figure that out face to face. So some people may want to bring in a caregiver from the outside, and that is okay. And if you are especially a person living alone and you have somebody who would be willing to come in, say an adult child or older grandchild, or someone who's willing to self-isolate with you, that would be great if you could find somebody who wasn't at high risk for severe COVID illness who would be willing to come in and help you. But they have to self-isolate with you. They have to live with you in the same manner as a current cohabitant. So that means coming and going caregiving of family and friends and professional caregivers, just like home cleaners, isn't allowed because it increases the risk of contagion to our community. Both they're coming in from the outside and moving back to the outside, and their movement through our common spaces as a contaminated person. So the health team just really feels like there's no way to do that with any safety. That also means that the common spaces, including our guest rooms, can't be used by anybody caring for a person with COVID-19 symptoms. The same problem applies, is the inability to get people in and out without creating infection risk for everybody else in the community. And then when the outside caregiver is ready to leave the community after sufficient recovery of the ill person, they would need to contact the health team, and we just have to talk about how to get them out of the building, because they would then be in a 14-day quarantine because of their exposure to the virus. So we just need to be sure that they're not running through the common spaces on their way out the door. All right, so it's really important that, again, you're in touch with your primary care provider through any illness that you might have. It's important that you understand for you as a person what symptoms that provider thinks requires an in-person evaluation for possible hospitalization. That will be different from person to person in this community, and so it's not for the health team to say what's right for you. That's something you have to discuss with your PCP. But in general, those symptoms would be worsening of your shortness of breath, so that you can't do simple activities, even like getting up to use the bathroom or speak an entire sentence without taking a breath. And oftentimes that's accompanied by a lot of weakness, because oftentimes you don't have the oxygen that your body needs. That leads to an increasing inability to care for yourself at home, and that always goes hand in hand with the falling oxygen saturations. Now, we do know that we have some pulse oximeters here in the community, and if it's appropriate, we can put those into your home, and you can, if you're very sick, you can be checking your own pulse ox readings. And again, that's the percentage of oxygen saturation in your blood. Some, what do you call those things? Apps for your cell phone are also available out there. There's some varying opinions about their reliability. So for people who aren't very sick, that might work, and you could just use your cell phone. But for people who are really kind of down and out sick, we would prefer that you would use a real live pulse ox. And we can certainly talk about that at some point in time. In fact, we've even talked about having a pulse ox class so that people learn how to use it before they're sick. Other new acute symptoms, sometimes other organs start to show signs of problem. So again, whatever you and your doctor agree is the criteria for you to leave the building to go for an evaluation. That's what you need to pay attention to. And if it is time for you to go get evaluated, go get a chest x-ray, or have something happen, it's really important that you contact a member of the healthcare team so that we again can make sure that we can move you safely through the common spaces to your outside transportation, so that we have a minimum amount of contamination in our common spaces. So that's kind of the summary of the guidelines. And now what I would like to do is have you chat in questions to our kind host, Dave, who is sitting down here in the media room with me. And if these are questions about but what about my situation with such and so, we'd prefer that you wait and ask those individually to the healthcare team. If you just want to make a comment about how much you do or don't like this, we'd prefer that you actually write that down on a piece of paper and put it in one of the cubbies of the healthcare team. But if you have a question like, I don't really understand this, can you explain what you mean by this? That's the kind of question we're hoping to have. Since this is an information session primarily, we're trying to give you information and we want to make sure you understand it. So, Dave.
It's a long time since I've been called a kind person. That's great.
Oh.
Yeah, so you can chat, you can put your questions in the chat to everyone, or you can give them just to me. As Gretchen just said, questions of clarification, which is our goal, information clarification. I'll certainly pass on so she can deal with those. Other sorts of questions she'll tell you how to deal with later on in the presentation. So I'm not seeing any questions yet. Anybody?
Are we that clear?
Question of clarification? Maybe they fell asleep. Oh, here's one. Can't hear Dave. Can you hear me, Gretchen?
I can hear you. I'm not sure. It could be coming through my speakers.
So, Gretchen, maybe you need to repeat after me on the questions.
Dave says he doesn't see any questions.
Dave's mic is not on.
Okay,
Can you hear me now, folks? Dave is better now. Now I've lost my questions. I hear Dave. Great. Going back up to the questions, folks. What about dirty laundry for those who don't have washers and dryers?
Yes. We'll have a sub-protocol. That's kind of what the health team is calling these kind of little things that we're going to write. And one of those is about how to allow the sick person to have trash and dirty laundry. You can set it outside the door. We would likely double bag that and then move it down to the laundry room to wash and return it outside your door. So you would not be like having piles and piles and piles of dirty laundry. That's one thing we can do, and we can do it safely. Yes, you can always call 911 for an ambulance. I think that our ambulance people, I think they call them EMTs, would probably come in a lot of protective gear. I mean, ordinarily we would prefer not to have outside people coming into the doors of PDX Commons, particularly if they've been exposed to other people with COVID. So our optimal arrangement would be to probably have the health team move you down if possible, to the entryway so that you could meet the ambulance there. But there are also other ways to do non-emergent medical transport as well. And again, the health team is going to develop a whole bunch of resources that will help with those questions.
The next question, how does testing for COVID fit into the sequence of events? Is that something that a personal health care provider would arrange?
So with COVID symptoms inside of PDX Commons, we're going to assume if you have COVID symptoms, you probably have COVID. It's kind of one of those things, if it looks like a duck and quacks like a duck, it's probably a duck until it's proven to be a goose. So it may be that you go into isolation, and if you arrange with your primary care physician to get testing somewhere, we will again escort you outside. Make sure you get outside, dropping as little virus as possible to get tested and then bring you back inside. But you would again have to maintain isolation until there was evidence that this is not a COVID-19 infection. And I think that those test results are coming back faster, but I think it's still taking some days, unless there's a really fast one in Portland right now, and I'm not sure about that. So yeah, like I say, for the most part, this is going to be presumptive COVID illness that will be treated as if it is COVID illness until we demonstrate that it's not.
Who double bags the garbage, the ill person or the other person? For this is somebody would have a partner, so who double bags the garbage?
So again, we're working on that sub-protocol, and if you want to know what that is, we can put that answer out to the community. The health team has been most concerned about getting out these main guidelines, and we're working on all the little kind of isolation details in the next week. So don't worry, we'll figure it out. But those are all good questions, and they're questions that we're dealing with.
Here's another question. Why are you asking us to report our temperature and symptoms to the health care team? What will they do with the information? And what if we prefer to discuss our health with our healthcare provider?
This is not an either or. This is not an either or. You would always discuss your symptoms with your healthcare provider. The reason that the healthcare team needs to know is because we need to understand where the risk is in the building and how we need to mobilize to make sure that that risk stays isolated. And if people are silently ill with COVID inside the building and nobody has any idea, that puts us more at risk, I think. And it also certainly does not provide support for that household in any way, in any of the ways that we can help support. And we have numerous ways to help support if we know what's going on. The other reason is because if you do need to move in and out of the building, or you do need to have laundry done, or you do need to have trash changed, or you do need some meals prepared, we would just need to know about that. So it's not so we can broadcast to the community what's going on, but it's just so that we can help with infection control and meeting the needs of somebody who's potentially very sick.
One of our single housemates here says, if I don't have someone who can dedicate themselves to my care, then no one can come into my space while I'm sick. I would like to know if you will have regular digital contact with sick people by the health team and the mitzvah squad.
Why don't you hold that question, because I think we'll say more about that when we get to the planning worksheet. So if I don't get that question answered in the next section, let me know.
And then there's a question, I think, well, will we know if somebody is sick within the building?
The health team is aware that we're trying to balance the needs of the community for safety with the needs of any potential person for privacy. So I think that that would be a discussion that we would have with the person who is ill about what they are willing to have shared with the community. There is no rule about that. That's a challenging situation, and we acknowledge it's a challenging situation. I would kind of hope that anybody who's sick within the community would allow the community to know that someone is sick. but that's certainly not something that we can force people to share, and people do have the right to privacy.
All right, I'm looking to see what else. We have one question that's a follow-up from a question we had, so I think we can refer that one to a written question later on. Lost my place in the queue here. One moment. That's all we've got, so we can go to the next section and,
so let's go
move
on. So what we're going to do is move on to the other document that was sent out, and that's the My Plan document. And this is probably the hardest thing to do. I mean, it's one thing to sort of absorb all this information, but it's another thing where we're asking you to actually do something. And we're aware that some of you will resist doing this, but we really hope that most of you will. Each individual, even if you're in a couple or cohabitating in some way, we would like each individual to create their plan for dealing with a potential illness. And this is to help you think through what you would do. Now, even on the health team, we talked this morning, just very briefly, about us sharing our plans with each other. And we're all like, you mean I have to do it too? I mean, it's really easy to not want to do this because it's trying to think about something that you don't want to have to think about it and what you hope won't happen. But we're still going to ask you to do the hard thing. And part of the reason is because, again, while this, if we're lucky, evidences as kind of a bronchitis, cough-y, sort of fevery thing, there are too many people, especially older adults, for whom this can result in a week or more of severe illness at home. It is not uncommon to have unrelenting, what we call oscillating high fevers that go on for days and days, and that just wrings people out. The chills and sweating that go along with the fevers and the breaking fevers and the return of the fevers, the weakness that can lead to difficulty with even the most basic activities, and a lack of interest in maintaining your hydration and eating, the extreme fatigue that comes along with this kind of sickness. So we want people to realize that this could be perhaps the sickest you've ever been in your life if you were to get this, although we hope that it wouldn't be. It's possible that it could be. And even still, even if you were this sick and you were sick for a week, with any luck, you would then turn a corner and get better and still not have to go to the hospital. That's what we would certainly hope for, is that most of our bodies can create some of those antibodies and fight this thing off before we would have to go to the hospital. But this is serious, so you need to think about it. So again, think about the things that we can't do for you, that as a community we would oftentimes do for you. Number one, of course, is substitute for the advice of your healthcare provider. We're not going to do that. We will try to support the advice of your healthcare provider. We can't come in and change your sheets or deal with your laundry. We can't come in and make food. We can't come in and assist you to move around if you feel weak. We can't come in to check your temperature and oxygen level. We can't come in and clean up for you. We can't come in and clean or care for or feed your pets or clean your litter boxes. So all of those things are like, okay, if I was feeling really, really sick and I was having trouble getting out of bed, how would I cope? How would I do this? And as much as we want to fix this for you, we're going to be pretty helpless on the other side of that door. And it's not going to be without a lot of anguish, for sure, from your friends and the people who care for you, that we can't expose ourselves and then go into quarantine ourselves because we're exposed. But there are things that we can still help with, and Mitzvah and Health Team are standing by. One of those things is certainly we can stay in digital contact with you on a regular basis to make sure you're hanging in there. And I think every member of the health team would be willing to make sure that they're connecting with you 3 or 4 times a day just to make sure you're okay in there and that you're getting what you need through that door. We can also support you digitally in following instructions of your healthcare provider, including what meds you're supposed to be taking, how often you're supposed to be taking your temperature, whether or not they want a pulse ox from you. We can help support you in those things. We can always drop food outside your door. We can bring you soup, lots of soup. And you're probably not going to want much more than that. We can pick up your laundry and your trash using safety protocols. We can assist you to move through the building to the outside using safety protocols. We can, any deliveries of groceries that you've ordered or other deliveries, we can bring those up to your door. We can walk your dog. So those are all things we can do without coming into your place. So we're not completely helpless, but we can't help nearly as much as we wish we could. So again, we want to remember that if one person in the household is sick, everyone living there stays isolated and you don't get to come outside. That's a bummer. So the prompt statement for your plan is basically, if I develop symptoms of COVID and have to completely isolate myself from the community and from any co-inhabitant inside my home for what is likely to be at least 2 weeks, this is my plan. And so then I just added that little statement as we're working off presumptive COVID-19 illness until proven otherwise. So the first question is, where do I want to be? Where do I want to isolate myself for the course of my illness? And that's probably the #1 question. Where should I be? Now, most of us will probably say, this is my only choice. I have to be here. I don't have any other choice. There are others who might choose to go to a family member's home or a friend's home or some place where they've got a bedroom and hopefully a bathroom that they could sort of essentially just wall off for you within their home for you to be able to be sick in the presence at least of somebody who's in the same building, who can move in and out a little bit more easily than we can here at PDX Commons, where we're worried about contagion in the entire community. So moving into a single family dwelling where there's a little bit more control over space is a possibility. So some of you may go to an adult child or to a friend who still has a single family dwelling and say, would this be a possibility if I got sick? That's something that you can consider. Others of us might choose to flee off to our second home and be sick there. And a lot of that would be basically to avoid the risk of contagion at PDXC. So we would just fly the coop and give the community one less thing to worry about. Others obviously don't have that choice, and we're really aware of that a lot of people just have to stay here and they may just have to go it alone. So, but do carefully, try to think outside the box, talk to your family about it. Try to figure out any possible option that you can. There are some very creative ideas floating around out there. So, you know, even doing rentals for a while, there's really creative thoughts. So don't just assume that you have to be alone in your place here at PDX Commons unless really there isn't any other better option. If you're isolating with someone else, or you're planning to bring in somebody to hang with you during the course of this illness, how will you isolate yourself from that person in the home? And again, that's pretty much the separate bedroom and hopefully a bathroom, so you're not sharing that space. How will that person then isolate from the rest of the community, given that they're not allowed out in common spaces or in the guest rooms? And then that kind of like, oh, for heaven's sakes, what if we both get sick at the same time? If you have co-inhabitants that were exposed at the same time, it's very possible they could fall ill within a day or two of each other. And how would you cope with that? What would your plan be for that? So that's a little bit of a rabbit hole, but it's been known to happen. If you are going it alone, your question is, how will I find the support I need if I'm feeling really sick? Again, within the limitations of what we feel able to provide safely here. And then, you know, work hard to think of a backup plan. You know, it's possible that if you became so ill that you couldn't take care of yourself adequately here, you could be hospitalized. And since Portland doesn't seem to be at capacity of our healthcare system, it's possible that hospital beds would open up for people who are struggling that much. So that's something that you would definitely want to talk to your PCP about if you find that you're just really struggling even to get up and go to the bathroom, or can't figure out how to feed yourself. Those are reasons why we would need to figure something else. And of course, that your health team is always here to help you think through these possibilities. Because like I say, we're living and breathing this stuff right now. And we've gone down many rabbit holes trying to figure out how we can help you make the best plan. So even if you're sort of physically alone, you're never alone, because we're always just on the other side of a digital device. How will you meet your needs if you're sick? For groceries, meals, surveilling your condition, making sure that you're taking regular temperatures. Who's going to take care of your pets? Who's going to change your litter boxes? How is your laundry going to get done? How is your trash disposal? And again, those last few, we've talked about the ability of the community to help out with that using isolation precautions. How will you get your medications and other supplies? If you need assistance in contacting your healthcare provider, how would you see doing that? What other types of needs can you imagine if you're barely able to leave your bed for a week? So we're trying to get you to think about where the rubber hits the road here, so that we don't have people doing far worse because they didn't plan ahead than they would have if they had a plan and we all knew what to do, how to help, what your backup is, who to call, all those kinds of things. Speaking of communication, by the way, one of the things we want in your plan is that you have the ability to use some type of communication technology from your bed, so that you can remain in contact with your healthcare professional and the community. Because again, we're going to be out here worrying. So we want to make sure that we are able to know that you're okay. So make sure you know the platforms that you're able to use, particularly those that allow for video. The telemedicine docs are really, video is very helpful for them because when they can see you, it goes a lot further than if they can just hear you. So video capacity is really good. And then make sure your family also knows what those platforms are so that if you're sick, they can also be in touch with you. We also want to make sure that you've, ahead of time, don't wait till you're sick, ahead of time, checked with your PCP office and understand how to use their version of telemedicine. A lot of our primary care doc offices and healthcare systems have just exploded their capacity for telemedicine because they don't want you guys coming in, right? I mean, they don't want to see you in person. So you want to know how to use that. And you also want to know how to access help 24/7. So figure that out now before you need that help. If I have to call my doctor at 1 a.m., how am I going to get a hold of them? How do I use this telemedicine platform? Figure those out before you get sick. It's really, really not good to do it when you've got a fever 102. All right, so the readiness check. What is your plan to stock up on food and supplies to cover a possible 2-week in strict isolation? And the question to ask, of course, is if I woke up in the middle of the night tonight with a fever of 102, that the hallmark of an onset of COVID illness, and I'm not able to leave my home for the next 2 weeks, am I ready? Okay, and again, don't assume that just because you have a well spouse means that they can go then running out to the grocery store and stock up. As soon as you go into isolation, they go into quarantine with you. So if you're not stocked up, I would say it's a really good time to do that, even though we don't want you going to the grocery store. The emergency contact form really kind of becomes increasingly urgent in a situation like this. Most of you have filled one out. We have most of them in the desk drawer in the office, but about a third of you we still have no idea. We still have no idea. If you got very sick very quickly, we would have no idea who to call. So truly, if you haven't filled that out, this is a pretty darn good time to do that. And I can get you a copy. There's copies all over the place. So get your health form, your emergency contact form filled out. Now, let's say you work through all that and you made your plan. What we would like to do is to have you contact any member of the health team to review that plan, to help think with you about, will this work? Is this hopefully going to be enough? And is there a plan B? And is it safe? Whatever it is you're planning to do. We would hope that many of you would feel comfortable doing that with some member of the healthcare team. We would also very much encourage you to talk to your family members and loved ones about what your plan is, so that your family also knows what it is that you're planning to do if you get sick, and what we can and can't do for you here at PDX Commons. And then it'd probably be good to tape it to your fridge or keep it very handy. Again, it just helps to be able to have something to refer to that's not kind of thrown away and you can't find it again. So just hang on to that. And then, of course, once you've got your plan done and everything's done and you've thought about it, then leave that space for a while. You don't have to live there. You don't have to obsess about it. You don't have to be anxious about it all the time. You make your plan, you do what you can, and then you drop it over there and go live your life and do the stuff that increases your immune response instead of decreases your immune response. We know that ongoing stress compromises your immune system, so you don't want to live in that space of fear and worry and anxiety about what if, what if, what if. We want you to just do it, have it done, set it aside, and then go dance on the walkways for a while. It's the joy and the sunshine that's going to help your immune system stay strong. All right, let's have some questions about the worksheet.
Well, here's a good question. How do I know when I'm well enough to leave isolation again?
Oh, you think we don't have some protocols for that? We do. And it's actually in the guidelines. I didn't put it on a slide, but there are guidelines straight from the CDC that are, and again, your primary care doc will help you with this, but generally it's at least 3 days after your fever subsides and you no longer need fever reducers. That's off your Tylenol and ibuprofen, so 3 days, or at least 7 days after the onset of your acute symptoms. So those are the two main ones. But again, your primary care provider will probably tell you when it's safe.
Great. A little kind of follow-up question on if you're alone. It says, if I'm alone and I get sick, is it better to be somewhere else other than here in the community? So maybe you could just sharpen that a little bit.
I don't know that there's an answer for that. I think there are nuances to that question and a lot of unknowns about that. If you were a single person and you were not very sick, you could probably do it. If you were a single person and you got really sick, it would be a challenge, and you would probably be better off somewhere where you had 24/7 caregiving help in the building, in-person type of caregiving help. But we also know that that's not something that everybody can find. We all don't have friends and relatives who are not at risk for severe COVID illness. So that would be really healthy people under the age of 60 who would be willing to risk that exposure. Now, we also know that cohabitants of people with acute COVID illness oftentimes do not get the illness. So it's not a sure thing that if you live with someone with COVID illness, that you too are destined and doomed to get it, particularly if you're able to be really careful with your isolation techniques. But nevertheless, we all know that it's a lot to ask, and many of us probably would be hesitant to ask our adult children to give us a room in their home if we're bringing in the COVID virus. But on the other hand, I think your kids would far rather have you do that than be very sick at home alone here without somebody to help you. So there's a lot of nuances to that, and some of that may be that it's plan A and plan B. Plan A might be if I'm managing on my own, and plan B might be when things get too hard for me, I might move to another location if that's available to me.
So in a similar vein, and a great kind of sense for being community here, the question is, if somebody in a community who is single is sick and recovering, could we bring them into ours, a larger unit that has a separate bedroom and bathroom?
I think that there's no way that we can say, no, you can't make those decisions for yourself. But generally, the CDC recommends against people who are highly vulnerable to severe COVID illness to expose themselves directly in their own homes to COVID virus. And unfortunately, there's not very many people in this community who don't qualify as highly vulnerable. So I think it's a very altruistic thing to consider. And again, I don't think that we could say you can't do that, but it would put yourself at some risk, because while not everybody who cohabitates with somebody who's ill with COVID, there's a significant percentage that will then contract the virus.
Okay, we've got a comment. Somebody's got a bottle of water and crackers by their bed already, just in case, so they can stay hydrated. They've started their plan. That's great. Another question. If someone chooses to leave the building to go to someone else's house or their second home for self-isolation, should they contact the health team to arrange for a safe exit through the building to the outside?
Yes, please. Yes, please. Anybody who's in quarantine, anybody who's in isolation, and those are two different things. Isolation means you're sick and you have to isolate yourself. Quarantine means you're not sick, but you're keeping yourself away from everybody else because you have exposure. Okay, and so there's a reason why you're at high risk for carrying that virus. In both of those cases, we just want to be very sure that we're protecting the community as much as possible as you exit the building to go somewhere else. That's the same if you're going to a healthcare appointment. That's the same if you're leaving to move to another location or to go to a friend's house or a family member's house. Yeah, that's a good question.
Then we have a follow-up question from before, which may be a better individual question, but it has to do with the limits of what the health team really needs to know or not know as they do a health team. So is that something better asked with you as people work with individual plans?
Probably that's something that you'd want to check with us about. Again, I think that our fear is that people will sort of hunker down with COVID symptoms, and a lot of bad things can happen if somebody in the community isn't clued into what's going on. It's really hard to imagine that one could stay very sick without some assistance from the community if you're isolating in place. It's hard to know how that could happen. So again, I think any member of the health team would work very hard to make sure that we're respecting your desire for privacy as much as possible in anything that we would do. But it's helpful for us as we attempt to try to keep this community safe, that we sort of have some idea of what is going on. So hopefully that you would trust us to be able to walk that really fine line as best we can. So chat with us about that if you have more concerns.
Okay, so we have no more questions at the moment. People seem to understand what you presented. There's no more questions here about the worksheet. If people think of questions later on, what should they do?
So if you've written down any questions on your piece of paper and you want to throw them in a cubby of a health team member, I think you know who we are by now. It's Karen E. and all the nurses ratchet, we call ourselves. So just throw it in one of our cubbies. We're not done meeting. We've been meeting and meeting and meeting, and we will keep meeting and meeting until we feel like we feel confident that we're ready and we know what we would do, and we would know how we would manage every little piece of this. So if you have questions or inputs or just sort of feel like you want some help in exploring your own personal situation, we would be happy to do that. But I'm really serious about once you spent time diving deep into the unpleasantness of this plan, I really want you to make the plan and then don't obsess about it anymore. I think many of you will feel better, and it might actually help you sleep better at night to know that you have a plan. Because sometimes it sort of helps that free-floating anxiety to actually get something down on paper, say, okay, now I know what would happen, and you'll probably sleep better. But try not to go back and second guess yourself and obsess about the plan. Once you've got it made, be ready, then let it go. Okay? All
That
right.
sounds great. People are appreciative. Karen Jolly says it's beautiful outside, so let's go enjoy our lives for a little while.
Is it happy hour time?
Gretchen, thank you on behalf of the community. They're clapping and waving and all those sorts of things.
Oh,
So thank you to
so
the whole
sweet.
health team, not just you, the health team.
All
All
right.
right. Thank you all. Take care.
Go out in the sun.